My name is Anna Clarke and I work for Diabetes Ireland. This video is about managing glucose levels when you're ill, if you have diabetes, regardless of what type of diabetes you have, type 1 diabetes, type 2 or pre-diabetes. You need to be aware that if you get any illness, your blood glucose levels will rise and you need to control those, because if they stay elevated, the illness will become more serious. In order to prepare for illness, it's important that you have some things in the house. For example, every person with diabetes needs to have a sick day regime. You should have got this already from your diabetes team, but if you didn't, go on to www.diabetes.ie and download the general guidelines for sick day for type 1 diabetes or for type 2 diabetes, whichever is more appropriate for you. Pre-diabetes will be similar to type 2 diabetes. You also should review the patient information leaflets that you have got with your medications, just to see if any of those should be adjusted if you are ill. If you are using insulin, never stop taking your insulin, and you should have a stock of ketone sticks to check what your ketone levels might be, and if they were elevated, what actions need to be taken. If you have a pump, it's important that you have backup basal and bolus insulin, because the last thing you want to do is have to deal with a pump failure and trying to get insulin at the same time. Everyone is advised to have some paracetamol liquid or fast-acting paracetamol in their cupboard in the case of getting a fever. A fever is a temperature over 100 degrees Fahrenheit or 38 degrees Celsius. It's important to keep a fever down if you're ill, because that will actually raise your blood glucose levels as well. Naturally, you need to have a thermometer in order to be able to check your fever levels. It's also important that you consider what foods you might need or drinks should you become ill. Everyone is advised to keep hydrated, and therefore you should be drinking 2 litres of fluids per day, and generally these will be sugar-free drinks. However, if you're ill and are unable to eat, then it's important that you have some ordinary regular 7-Up or some drinks with sugar in it to take, because you do need to keep your energy up. The likes of fruit juice, milk are good options when you're not able to eat. It's also important to have some light foods, so maybe have some ice cream in the freezer and low-fat yogurt in the fridge, tinned soup in the press. If you do get ill at any point in time, then it's important to keep drinking. Even if you don't feel like drinking, you can sip either hot water, sugar-free cordials, or if you're not eating at all, you may need to be taking some regular 7-Up or light fluids. Keep sipping them, even if you can't manage to drink a glass at a time. Aim to take a glass per hour. Keep taking your meds, even if you are unwell. Specifically, if you're on insulin, you need to increase your insulin dosages, and that is part of your sick day regime. If possible, try and continue to eat normally, and if not, take light fluids. And of course, if you have a temperature, treat the temperature. You need to know when to seek medical help for your diabetes management, and generally it's accepted if your blood glucose levels stay above 15 or if they're consistently below 4, you should seek help. If you're unable to keep fluids down, if you're vomiting, then you need to seek medical attention. If your temperature remains elevated, that in itself will warrant attending a medical person. And if you become dehydrated, and you will know this by your mouth being dry, maybe diminished amount of urine being passed, but that can be interfered with some medications, so it's not something to rely on. If you become in any way confused, or if you feel that your skin is very dry or your eyes are a little bit sunken in your head, then it's highly likely you're dehydrated and you should be attending for medical care. I hope you find this information useful. Please support Diabetes Ireland so that we can help you and help the diabetes community.